Artificial intelligence creates new antibiotics to fight superbugs resistant to treatment. In what scientists are calling a potential revolution in modern medicine, artificial intelligence has designed two powerful new antibiotics that could finally turn the tide against two of the world's most dangerous superbugs, gonorrhea and MRSA, methicillin-resistant Staphylococcus aureus. Both infections have grown increasingly resistant to traditional drugs, leaving doctors with fewer and fewer treatment options. The breakthrough comes from a research team at the prestigious Massachusetts Institute of Technology, who believe this marks the beginning of a second golden age of antibiotic discovery. For decades, the medical world has been warning that antibiotic resistance could push humanity back into a pre-antibiotic era, where once treatable infections become deadly again. The World Health Organization has already declared antibiotic resistance one of the greatest global health threats, with over 1.2 million deaths each year, directly caused by resistant infections. What makes this discovery so extraordinary is the way the antibiotics were created. Instead of relying on traditional trial and error methods, the MIT team harnessed the power of artificial intelligence to build new compounds, atom by atom. These AI-designed antibiotics proved lethal to superbugs in both laboratory conditions and mouse models, raising hopes that entirely new classes of drugs may soon be within reach. But there's a catch. The journey from the lab to the hospital is a long one. The drugs must still undergo years of refinement, safety checks, and clinical trials before they can be prescribed to humans. And history shows that many promising antibiotics fail before reaching the finish line. How artificial intelligence beat the odds. Antibiotic research has stagnated for decades. Pharmaceutical companies largely abandoned the field due to high costs and low profits, while bacteria evolved to resist nearly every drug available. To break the cycle, MIT researchers turned to machine learning, training algorithms with the chemical structures of thousands of known compounds. The AI was then taught to predict how those structures interacted with bacteria, learning, in effect, how to think like a microbe. The system screened a staggering 36 million chemical compounds, including theoretical ones that don't yet exist in nature. From this enormous library, the AI identified potential drug candidates that were not only effective, but also less likely to be toxic to humans. Importantly, it eliminated compounds that looked too similar to existing antibiotics, avoiding the trap of minor modifications that bacteria can quickly resist. The scientists employed two strategies. One started with small fragments of molecules, between 8 and 19 atoms long, as the foundation for building antibiotics. The other gave the AI free rein to generate new designs from scratch. Both approaches produced entirely new chemical blueprints, something human researchers would have struggled to imagine without computational help. A race against time. Experts warn that humanity is running out of time in the battle against superbugs. Diseases like gonorrhea, once easily cured, are becoming untreatable in some patients. MRSA, a hospital-acquired infection, still kills tens of thousands worldwide each year. Without new antibiotics, routine surgeries, childbirth, and even minor injuries could once again carry deadly risks. The MIT team's findings, published in the journal Cell, have sparked worldwide attention. If successful, these AI-created antibiotics could mark a turning point in the global health crisis. Still, researchers caution that the process ahead will be expensive and uncertain. Yet one thing is clear: artificial intelligence is no longer just reshaping technology. It may now be the key to saving human lives.